Hi, my name is Beth.
Hi,
I'll be your nurse for your physical head to toe exam. What is your name?
my name is Andrea.
Alrighty, Andrew. Do you understand what's involved with a head to toe physical
Yes,
exam?
I do.
May I may I have permission to proceed?
Yes, you do.
Okay, thank you. I'm just gonna wash my hands. Yeah, it does smell bad.
Sorry.
All right. First I'm going to assess your arms. The skin on your arms is normal for ethnicity, even hair distribution, no scars, no moles, no rashes. Hands are as expected, knuckles and fingers are as expected. Now I'm going to inspect your hair,
Go ahead.
see for even distribution and infestation, no infestations, and you have a nice even distribution.
Very nice.
And what I'm going to do now is I'm going to palpate your temporal artery. All right, that's good. Now I'm going to palpate your sinuses, and I want you to tell me if there's any pain when I do this.
No pain.
Okay, that's your frontal sinuses, and this is your maxillary sinuses.
No pain.
Okay, good. And I'm going to assess your neck. Skin tags noted. Skin tags noted bilaterally. All right. So what I'm going to do now is I'm going to check your eyes.
Okay.
Hazel green eyes, normal sclera, nice and white. Pink conjunctiva. Now I'm going to take a pen light and examine your pupils, how they react to light.
Okay.
All right, it reacts to light. Now I'm going to check your other eye for accommodation, which means that your pupils dilate and get smaller at the same time. They dilate and contract at the same time.
Okay.
And, all right, excellent. Next thing I'm going to do is I'm going to look into your eyes to check your optic disc.
Okay.
Okay? Nice sharp edges for your optic disc. And nice sharp edges for your optic disc. Excellent. Okay. Next thing I'm going to check is your lymph nodes. I'm going to check your post-auricular, your pre-auricular, your submandibular, your submental, clavicular, and if you could raise your arms up just a little bit, I'm going to check your axillary. I know you're ticklish. All right, excellent. Thank you very much. Next thing I'm going to do is I'm going to assess your temporomandibular joint. You could scrunch your teeth and open your jaw up and down. Perfect. Your joint is nice and in place. No rubbing, no ticking. Next thing I'm going to do is I'm going to check your ears.
Okay.
I'm going to inspect your ears. Any pain when I inspect your ears?
No.
Okay, so I'm going to look inside your ears with this otoscope
Okay.
and check your temporal membrane. Temporal membrane is beautifully pearly gray. Lovely. And again, beautiful pearly gray. Cleanest ears I've ever seen.
I do want to come on.
Next, I'm going to assess your hearing.
Okay.
I'm going to occlude your ear with your tragus, and I'm going to whisper some words, and I want you to I want you to repeat them back to me if you hear
Okay.
them.
Wonder Woman. In her satin shorts.
Wonderful. Okay, so next I'm going to do another assessment for your hearing.
Okay.
This is called the Weber test. Now I want you to let me know if you hear this, okay?
Yes. Yes, I do.
Do you hear it in both ears?
Yes.
Do you hear it in one more than the other one?
I hear it in this one more than this one because this is my bad ear.
Okay. Next I'm going to do the Renee test. I'm going to test the bone conduction for your hearing. I want you to tell me when you can no longer hear the sound.
Now.
And I want you to tell me when you can no longer hear the sound.
Now.
Okay.
I can't hear it right down there. Okay. Now.
And how about now? You just let me know when you can.
Now.
Okay.
That's my bad ear.
Yeah. Next, what I'm going to do is I'm going to take the pen light. I'm going to inspect your mouth. I know you have a hyperreflexive gag reflex. So I'm just going to have you open your mouth. Mucous membranes are pink and moist. Tonsils are in place. Good uvula. I'm going to have you the normal dentition. I'm going to have you stick your tongue out. Stick it. Raise it up. Raise it down. Little side. This side. All right. Excellent. Now is where I would test the gag reflex, but since she has a hyperreflexive gag reflex, I'm not going to stick anything in her mouth. So what I would do if I was testing the gag reflex is what I would have her open her mouth, say ah, and I would stick it tongue depressor in her mouth. But she has that hyperreflective gag
I
reflex.
have a hyperreflective gag reflex.
Okay, so next I'm going to check your visual acuity.
Okay.
I'm going to test your peripheral vision.
Okay.
Okay, and I want you to tell me when you can see my fingers wiggle.
Now.
Okay, excellent. Now I'm going to test your eyes. I want you to watch my finger with just my eyes. Okay? Excellent. Very good.
Thank you.
All right, now I'm going to palpate your carotid arteries once at a time. All right, now I'm going to auscultate your carotid arteries and listen for bruits.
Okay.
All right, excellent. Next, what I'm going to do is I'm going to listen to your heart. Okay, and I'm going to do that two ways. I'm going to do that with the bell and the diaphragm on my stethoscope.
Okay.
Okay? Listening to the aortic, pulmonic, S1 and S2, Erb's point, S1, S2, tricuspid, S1, S2, and the mitral, S1, S2. Okay, I'm going to listen to this with S1, S2, S1, S2, S1, S2, and S1, S2. Okay, doing okay so far?
Yep.
Okay. Next, I'm going to assess your lungs.
Okay.
Okay, so what I'm going to do is I'm going to feel for fremitus. I'm going to have you say 99.
99.
All right, I'm going to have you turn yourself to the wall. I'm going to say 99.
99. 99.
Okay. Now, the next thing I'm going to do is I'm going to check for symmetric expansion
Okay.
of your chest. Now, I want you to Take a nice, good, deep breath for me. Okay, good job. All right, thank you. Come turn around this way. Now I'm going to listen to 6 points on your front and 10 points on your back.
Okay.
And say 99 for me.
99. 99. 99. 99. 99. 99.
Excellent. Lung sounds, all lung fields are clear. And I'm going to ask you to do the same thing again.
99. 99. 99. 99. 99. 99. 99. 99. 99. 99.
Excellent. All lung sounds are clear. Yes, I know you're ticklish. You're doing wonderfully so far.
Thank you.
Now I'm going to palpate your chest.
Okay.
Make sure that all is the appropriate tympani. All right, I'm going to ask you to turn towards the wall again. All right, excellent. Now, if you were in the hospital or hospitalized or anything, I would be visually inspecting your abdomen. But since we're doing just a physical outpatient head to toe exam, I'm just going to feel your abdomen. And what I'm going to do is I'm going to ask you to lay down. Normally I'd be doing everything on your right side. That is
Do you want me to spin around?
No, you're good. So what I'm going to do first do is auscultate all 4 quadrants of your abdomen, listening for vowel sounds.
I don't think I have those.
All right, excellent. Vowel sounds in all 4 quadrants. Next, I'm going to percuss, just like I did with your chest.
Okay.
Now there's some area of dullness here, so you could have some stool in this area.
It did feel a little dull when you.
Yeah. All right, now I'm going to be doing some light palpation.
Okay.
Any pain?
No.
All right, next I would do deep palpation to feel for masses, but not going to do the deep palpation.
I do have a hernia.
She does have a hernia in this area right here. Okay, so now I'm going to palpate for your liver. All right, your liver is just like 3 centimeters here, and your spleen is not palpable. But excellent. Now I'm going to listen to the arteries in your abdomen.
Okay.
Listening for the aorta, renal, iliac, and femoral.
Which is very ticklish.
Yeah, you are very ticklish. I'm sorry.
Okay.
Okay. No bruise or swishing sounds heard. All sounds from your arteries are normal.
Good. Sorry, it just found where I lost my lip line.
Okay. Next, I'm going to check your range of motion.
Oh, I'll sit up for that.
Okay.
It might be easier. There we go. Oops, sorry.
That's okay.
Alright.
shoulder, and in your elbow, and in your wrist. Excellent. So I want you to, I'm going to test your biceps. Okay, test your triceps. All right, now I want you to stop me from pushing down. Okay, excellent. Now I'm going to ask you to lay down again. I'm going to check the range of motion in your lower extremities.
Certainly.
Range of motion in your hip and knees. Range of motion in ankle is limited due to surgery. Hip, knee. Range of motion in this foot is particularly limited due to status post amputation of metatarsals. All right, so what I'm going to have you do is I'm going to have you sit up again.
Okay.
All right, so I want you to lift up your legs and keep me so. Okay, now pull your legs down. Excellent. Now keep me from pulling. Excellent. Okay. Next, I'm going to be checking some neurological.
Okay.
Okay. So what I'm going to have you do is to frown, stretch up your eyes, puff out your cheeks, and smile, and raise your eyebrows. Okay. And shrug your shoulders for me. Excellent. Now what I'm going to do is what's called the sharp and dull test.
Okay.
So I'm going to touch parts of your body while you close your eyes, and I want you to tell me if they're sharp or dull.
Okay.
Okay?
That feels sharp. That feels dull. That feels sharp. That feels dull. That feels sharp. That feels dull. That feels sharp. That feels dull.
Okay, I'm going to test down in your legs.
Okay. That feels sharp. That feels dull. That feels sharp. That feels dull.
Okay. Now I'm going to have you grip my fingers as hard as you can. Excellent. Very, very good. And we're almost done with the exam, okay? Now I know that you're ticklish, so I'm going to know that you're ticklish, but I'm going to write something on your palm,
Okay.
and I want you to tell me what that is, okay?
Okay. That was an A. That was an A.
Okay, excellent. Now I'm going to put something in your hand, and I want you to tell me what it is.
Okay. That feels like a AA battery.
Excellent.
Sorry.
And there you go.
Oh. That feels like a piece of American money. No ridge. Penny.
Excellent. Thank you very much. All right, we are almost done with the exam. Okay, so can you tell me your name again?
Andrea.
Okay, and where are you?
I'm in a bedroom.
Okay. And what time of day is it?
It's in the evening.
Excellent. Okay. Now I'm going to ask you to count backwards from 100 by 7.
Well, nobody told me there was going to be mathematics in this exam.
Oh, there is math
All
involved.
right, so it's 193, 86. More math, more math, more math.
Okay, that's fine. That is just fine.
In my head.
Okay, so I'm going to give you 4 words to remember.
Okay.
Okay? I'm going to tell you Eagles,
Eagles,
Ravens,
Ravens,
Steelers,
Steelers,
Bears.
Bears.
Okay, you remember that?
Yes.
Okay. So tell me how you celebrated your last birthday.
Oh, I celebrated with my family, and we all ate a lot of cake. Sugar-free cake, because I got the sugar diabetes.
Excellent, excellent, very much.
Yes.
I'm going to ask you to count back from 100 by 20s now.
Oh, that's easier. 100, 80, 60, 40, 20, 0.
Excellent, very good. Last thing that I have you do is I want you to tell me those 4 words back again.
Eagles, Ravens, Steelers, Bears.
Excellent. All right, wonderful. Thank you very much. That concludes the fiscal assessment.
Thank you very much.
Thank you very much.
I had a wonderful time.